The big interest in Panama has been the Panama Canal. And so, there's been a large American interest there, and now the world interest is obviously there as well. And it's doing well over the last 10 years. There's been a very large economic boom. But once you leave the city in many of these foreign countries in Central America, South America, once you leave the large cities, you're in rural areas that don't have the kind of healthcare that the large city might have.
Dr. Mark Stavros coordinates the emergency medicine curriculum and training of third and fourth year medical students at Florida State's Pensacola Regional Medical School campus. For the last 8 years, he has volunteered weeks of his time seeing patients in small communities in Panama.
Our clinic days, usually we're in places that don't have electricity. It's a school. We'd go to the local school, and they'd open it up for us. And each place that we actually went to 4 different areas this time. Each building did not have electricity, and it was our local school. And we would come in there, and we'd bring medicines in, and we would do this in conjunction with the local medical community. People would be, of course, waiting there when you get there, because you can never get there soon enough. And we'd see at least 100, probably as the minimum, up to about 200 a day.
This trip, however, Dr. Stavros and his team from Florida State brought with them a transportable exam station from GlobalMed.
Here's your longitudinal view from the uterus. You can see the entire uterus, a small segment of the endometrial canal, and then a normal appearing cervix.
This groundbreaking carry-on sized case contains the integrated medical devices, video conferencing capabilities, and image automation software that open the way to access healthcare where it may be limited or simply not available.
We had the capability to do ultrasound and EKG. We could do pictures of their eyes, skin lesions, look in their ears, and actually be able to interface with another doctor back in the United States.
I'd say welcome to sunny Florida, but it's pouring down, raining, and ice cold outside.
And so one of my colleagues from Florida State was on the other end, the receiving end, and could see the exam that I was performing on the patient right there in the clinic. And if we didn't have connectivity that day, I could store pictures, specific pictures where I could send it later to them and get input if I needed to have more input on a specific rash. I didn't know what it was exactly.
Dr. Stavros used Scopia as his video conferencing codec, which allowed him to provide video and images live to his Florida State colleagues.
Scopia is a very open, very easy to use tool from a video perspective that allows me to have very minimal knowledge of either end of the conversation and still drive a full-featured session back and forth.
Operating wirelessly, he was sitting outside the clinic when he uploaded patient images to GlobalMed's Capture Cloud.
I'm going to hit end session. And what that's going to do is that's going to send all those files to the cloud, and that's going to send it to my hard drive as well.
Okay.
And all those pictures on the left should disappear when that goes.
Okay. But they're available for viewing later, or can they be added to the patient's record?
Do more later.
All right.
Local physicians quickly understood the value of the transportable exam station, especially when it came to an eye problem common to Panama called pterygium.
That was one of the things I didn't expect, was the local doctor showed so much interest in it. He realized, wow, this is valuable to him, because now he can get all this information from his community with that availability to be able to render care remotely and not have to have that patient come to your clinic would be instrumental, would change that life.
Despite the long hours, Dr. Stavros says he comes away from Panama with a renewed sense of why the field of medicine is important to him.
When you start to go into medicine, I would say almost every student has altruistic ideas. And as you start to practice medicine, you want to hold on to those as much as you can. And sometimes you can lose focus. You can lose the whole reason you went into it in the first place. To know that there's no ulterior gain here except to go give of yourself is life-changing. It gives you perspective again.